This
Hello.
episode 1 of Medication Mondays. We're going to be talking about lithium.
All right. Lithium. Yes.
What is lithium and what is it commonly used to treat?
Lithium. Well, lithium is a very interesting medication because it's rare. Rare in that, I would say it's unique. It's lithium is basically salt. You can find it on the periodic table right under sodium, and so it's a light metal, technically, and so when you think about medications, you think about big molecules that they make in a pharmaceutical plant or something. And lithium is not like that as much because it's found in the water table, and it's an element that you find in nature. So it's a lot more natural in a way than you might think, since it's not manufactured. It's just an element. And lithium's used to treat bipolar disorder, and also it's used to treat unipolar depression. And I'll talk about that a little bit more. Lithium, I think, was first used in the 1950s, and they were trying to use it as a blood pressure medicine because it's an element and it's like sodium, and sodium in your blood goes through your kidneys. So they were using lithium to help with blood pressure management. And the idea there is, like, if you have too much sodium in your blood, it, it might raise your blood pressure. So if you have a diuretic and it allows you to urinate out more sodium, then your blood pressure should come down. That's kind of the idea there. They thought that lithium might be involved in that process somehow, especially since sodium has a +1 on it and lithium has a +1 on it. Or that's its charge, it's a positive charge. So while they were doing the studies in a hospital, I believe it was in Australia, some of the patients who were like depressed in the study, they started feeling better, and they noticed that their moods got better. And then they started using it in more research, and they showed that it did help folks with bipolar disorder, and then also unipolar depression. And when I say bipolar disorder, what's more discussing too, that means two poles. There's an up pole and a down pole. So down would be really depressed, and the up pole is not just like normal mood. It means like extraordinarily good mood, where people are too elevated. And those folks who have that phenomenon of being too up and then followed by being too down, and the upswings can last for, days to weeks, and the downswings can last for days, weeks, or months, or years for that matter. And so lithium is one of the main medications we use for that disorder, and it works very, very well. And it's probably underused because I think it's misunderstood, and it's also, you need to kind of be an expert in prescribing it because there's some side effects from lithium that can be toxic.
Okay. Speaking about the toxic, a common question is lithium toxic?
Yeah, it can be. We call it a narrow therapeutic window. So there's a window of lithium in your blood. Like, so if you're taking lithium, you reach a blood level after several doses of it, day after day after day. Usually it's about 5 doses of it, or 5 days of it. And then you reach what we call steady state. That means that the level is, steady in your blood. And if you take a new dose, it might go up a little bit, but it comes down to like the steady state on average. That steady state line in your blood needs to be in a safe zone. And we usually, that safe zone, we usually test in a lab to make sure that it's not going above that. Now, again, this is not medical advice for anybody out there on the internet here. So you have to ask your doctor about this medication. But the toxicity occurs when you go above the normal window, therapeutic window. Although some folks within the therapeutic window can have side effects as well. And that can be like feeling like you're drunk, having difficulty like walking or talking. Some people gain weight on it or have diarrhea. some folks can have a tremor. Some can feel tired, and I mean, there's a few other ones too. The main physiologic ones from long-term treatment of lithium can be kidney damage, and then thyroid. Your thyroid gland, which sits right here, can be affected by it. So part of our doctoring is to check someone's labs before they start lithium, and then while they're on the lithium, to make sure that everything is normal.
Okay. What's been your experience with prescribing it, and
Mhm.
common results?
Yeah, I've had a very good experience prescribing it because it's so effective. And it's one of those medications we usually reserve for later down the road for like treatment resistant depression. The reason for that is lithium can have some toxic side effects. So I'm less likely to use it in somebody who's just having the first bout of depression or something. Because I don't want to saddle them with that medicine for a lifetime. However, many people do take it for a lifetime and do quite well on it. So I don't want to give the impression that it's bad. Um, for bipolar disorder, it's one of the medications that's a gold in the gold standard classification for bipolar disorder, at least right now. And if something's very manic, like their mood's too elevated, you can use lithium, and it's a very good anti-manic agent. And if somebody's having depressive spell while they're in the bipolar storm, like they're in the depressed phase, lithium can bring them up out of that as well. So I use it more often in bipolar disorder. I use it less often in unipolar depression. That's like your garden variety depression. Um, but you kind of learn when to pull it out as a tool, and when not to.
Okay.
And it's
Um,
good. Sorry, and I should say it's good because the way lithium works is different than normal antidepressants like Lexapro or Prozac or those types of meds. And it works differently than antipsychotics like Abilify or Latuda. It works differently than lamotrigine, or that's Lamictal, or like Depakote. So its mechanism is novel. And in psychiatry, if someone's not doing well on a one mechanism, and then what I mean by mechanism, like it's like what the drug is doing in the brain to get somebody feeling better. If it's not working, you don't want to keep on using that same mechanism necessarily. You want to try different things. So lithium is kind of in its own category for that reason.
okay. Those were the common questions that I found. Do you have any like closing thoughts about it?
Oh, about lithium. Um, yeah, lithium is usually prescribed by psychiatrists, and if somebody were to take it, they do need to have a long conversation with their doctor about the side effects because it can be toxic. Um, but I wouldn't get worried. I wouldn't worry about it. If anything, there may be a lot of folks that would benefit from lithium that just never thought to ask about it because of popular culture. Um, like you hear about the word lithium. I mean, they have a whole 1990s grunge channel called Lithium, I think. You know what I mean? And you have a Kurt Cobain Nirvana song called Lithium. Um, the idea is like it's like extreme or something. When in reality, in psychiatry, lithium is a very commonly used medication, and it requires like one to have a good relationship with their doctor so they can have the discussion about it, and that they can be open with their doctor, that the doctor conducts what we call informed consent. Informed consent is when you warn a patient about the risk of a medication, you let them know about the benefits of the medication for which you're prescribing it. So I would say, hey, you have treatment resistant unipolar depression, or you have bipolar depression, or you have bipolar disorder and you're like manic. Lithium is indicated. I think we should use it for these reasons. These are all the risks of it, like some of the side effects we talked about today. And then the alternatives to this medication is that you could tell me to screw off. You don't need to take it. I don't want to take this, doctor. Tell me what another medication I can take. You could do therapy and not take the medication. That's an alternative. There's electroconvulsive therapy. There's transcranial magnetic stimulation for depression that we use. There's ketamine therapy for depression. There's a lot of other medications that one could use, but it's the doctor's responsibility to provide informed consent so the patients know what they're getting into and know that, hey, I'm going to have to order your blood work on lithium. I'm going to be looking at your kidneys and your thyroid, and I need you to go get these labs. Like, it usually requires a patient to be collaborative in all those things. And if a patient isn't, if I don't think they're going to get their blood work or that they're going to be able to really collaborate on that part of it, then I probably wouldn't prescribe it to them, you know?
Okay.
Yeah.
That's really good information.
Yeah.
Very
So.
thorough.
Yeah.
Liked it.
Thank you very much. Appreciate it. All right.
You're
We'll
very
talk
welcome.
next Monday.
Next Monday. Bye.
Okay. Bye-bye.